Can catheter cause pudendal neuralgia? So here I need to clarify what pudendal neuralgia is, because I think we all use pudendal neuralgia interchangeably, and when we talk about pudendal neuralgia, we actually mean different things. In my practice, and when I say pudendal neuralgia, what I mean by that is I mean pain in the area of the pudendal nerve. I don't mean that the pudendal nerve is injured. I do not mean that pudendal nerve is scarred or entrapped. I just purely mean that there is pain in the area of the pudendal nerve. And this is really consistent with the definition of neuralgia. If you go to a Webster dictionary of English language and you read what neuralgia is pain in the area of the nerve. Pudendal nerve entrapment is when the pudendal nerve is scarred, either in the scar tissue or the surgical material, and that is one of the conditions that may be causing pudendal neuralgia. So the question is, can placement of the urinary catheter cause pain in the area of the pudendal nerve? And then to answer that question, we have to briefly discuss what are some of the conditions that can be causing pain in the area of the pudendal nerve. So one of those I have already mentioned. That is the scarring of the pudendal nerve. And the answer is the placement of the Foley catheter, the urinary catheter into the bladder, will not cause the scarring of the pudendal nerve. There's really no mechanism in which it could happen. But the placement of the Foley catheter may cause significant spasm of the pelvic floor muscles, especially if the placement of that urinary catheter is painful. So we all have muscles in the pelvic floor, and this is again the female model of the pelvis. So if we look inside, there are muscles at the bottom of the pelvis. So those muscles towards the center of the pelvis, those are the levator muscles, and there are certain parts to that muscle. And the muscles on the sides are the obturator muscles, and the muscles towards the back are the coccygeus muscles. The urethra, where the Foley catheter is placed, it runs through the pelvic floor muscles, through the levator muscles. When the Foley catheter is placed, and that is painful to the patient, the muscles may clamp down in response to the placement of that catheter. When those muscles are clamping down, they will be clamping down around the nerves, and one of the nerves is the pudendal nerve. So as you see, the pudendal nerve actually runs through the muscle. It runs through the obturator internus muscle. So yes, the patient can develop pudendal pain or pudendal neuralgia as a response to placement of the Foley catheter. But this is not a real injury to the pudendal nerve. This is most likely the spasm of the pelvic floor muscles, which may feel identical to what the injury to the pudendal nerve would feel. Because again, those spasmic muscles will be spasming around the nerves, the pudendal nerve or the branches of the pudendal nerve or other nerves. And not only that the muscle by itself, spasmic muscle by itself hurts, but also muscle is spasming around the nerves, and that also gives you a type of a nerve pain. But the treatment in a patient like this is not to go and do the nerve decompression surgery. The treatment for a patient like that is to treat pelvic floor muscles. And that treatment, the best treatment, would be to do pelvic floor physical therapy by a qualified pelvic floor physical therapist. Also, I use vaginal or rectal suppositories with Valium, baclofen, and ketamine, which are very helpful. And in patients who fail physical therapy, who fail the suppositories, I offer those patients either Botox injections to pelvic floor muscles, which are very, very effective, or I offer them a Daxxify injection to pelvic floor muscles. Daxxify is a new type of botulinum toxin, which is a very same botulinum toxin A as Botox, except it is formulated to work for 6 months instead of 3. The disclaimer is that Daxxify is not FDA approved for injections into the spasmic muscles. Currently, it is only approved for treatment of the wrinkles. However, it is approved for the human use, so when patient is properly informed that this medication will be used outside of the FDA approval and patient is aware of that, then under those circumstances it can be injected into the pelvic floor.